Dr. Shailesh Chhotala, and I really thank Professor Dr. Ariel to invite me on this forum, international forum, I think, and I hope, you will get some good information from my sides. And thanks everybody. Now we can, go with the slides. Yeah, just lo just load. I mean, the first slide. Yes. As we all know, this is the diabetic foot ulcers and the diabetic neuropathy. We all know that we are treating sometimes the symptoms, and we are not thinking at the same time the cause of the diabetic foot ulcer. So this is the slide that elaborate that diabetic foot ulcer is the core part and the neuropathy is the small part, but it is reverse. So with this type of events, with this type of the events of the international forum, we can conclude the diabetic neuropathy and the classification of the diabetic foot ulcer. Can you move on the slides? So, we all know that diabetes is the leading cause of the diabetic foot ulcer. With that, we cannot, not without thinking neuropathy, peripheral vascular disease, some amputations also there just because of the neuropathy and only neuropathy sometimes. So, with the help of few slides, we will elaborate the things in diabetic neuropathy. Can we move on the next slide? Thank you. So the nerve dysfunction and the cell death, we all know that every diabetic patient on a certain period of time, they are getting some sensation problems and some deformities. So with that, this is the best slide. I think that hyperglycemia, dyslipidemia, and insulin resistance leads to the some polyol pathways, PARP pathways, and insulin signalings. So this will lead to the mitochondrial dysfunction, some inflammatory changes, some oxidative stress over the nerves, and some altered gene expression. So it will lead to the nerve dysfunction and the cell death. Next slide, please. So my core part for the 2 days talk is the classification of ulcers. Can we move on the next slide? Yeah. So this is the some causes of the diabetic neuropathy. Sometimes we have to, become serious on the hyperglycemia, dyslipidemia side. Patient have some hypoxia problems, some ischemic problem also there. We already talked on the last couple of lecture that vascular insufficiency, metabolic syndromes, some impaired insulin signalings, and some inflammation also, which will cause the diabetic neuropathy. Next slide, please. Yeah, next slide, please again. This is some, really interesting talk regarding the diabetic foot ulcer classifications. In internationally, every region has a, important classification to treat the diabetic foot ulcer. So, as earlier speakers also talked about something, Wi-Fi classification. Every classification has its own characteristics. So we'll, go one by one. So first one is the Wi-Fi classification. Second, Wenger-Magid classification. Texas classification, PADIS classification. Sometimes someone is following the King's classification, Cope's classification as well. And in India and in Asia, Amit Jain's classification is also there. One acre classification, and lastly, the not least the SAID classification. Next slide, please. So we'll go one by one. Wi-Fi classification, as I told you, everyone has a own characteristic in terms of wound, in terms of ischemia, in terms of infections. So Wi-Fi also the reputed, one of the reputed classification worldwide, and lots of doctors, lots of surgeons are following this. The next slide, please. The second one is the Wenger med classification. This whole classification has a own grade system according to the patient's condition, patient's food condition. They are, going into deep regarding grades. So this Wenger also one of the best classification. It will grade at 0 to 5. And can you move for the next slide, please? This is the classification depends on the depth and ischemia. The grade 1, as we can see in the slide, in the picture, grade 0, no break in the skin. Grade 1 will be the superficial ulcer. Grade 2 is the exposed tendon, the deep ulcers. And grade 3 is exposed bone and the abscess or the osteomyelitis. We are getting lots of cases day by day in our OPD like this depth, and sometimes it will with the ischemic conditions. So with the ischemia, grade A is no ischemia, grade 2 is the ischemia, but the not gangrenous. Grade C is the partial foot gangrene. We are getting on the grade toe or maybe the other part of the toes in the foot, and the grade D is the complete gangrene. So next slide, please. This is the Wenger classification. University of Texas classification is also stage versus the grade, and this is also one of the grade classification in terms of the wound and the ischemia. Next slide, please. Yeah, this is also one of the best in King's classification. Some region is following like stage by stage how diabetic foot ulcer in this stage, and they are putting the whole information in the patient assessment form. Grade stage 1 to stage 5 is the normal foot to necrotic foot. Next slide, please. Next, please. This is the COPS classification. And the important and the most interesting Amit Jain's classification. This is the, I think, one of the recent and good classification in Asia. Amit Jain's, he's the doctor in India, and he classified the things like type 1, type 2, and type 3. So type 1 classification gives the diabetic foot complications that are infective. It includes the like cellulitis, abscess, necrotizing fasciitis, some gangrenous part, etc. Type 2 classification, they considered diabetic foot complications like Charcot feet, peripheral artery disease, neuropathy, etc. And type 3 diabetic foot complications like type 1, type 2 complications, and a common example might be the careless ulcer with the underlying osteomyelitis. Sometimes we are facing that, we know that the ulcer foot is, from upside, it is just the dry, but sometimes when we open it, some pouch of the pus formation, some redness, and it will undergo an underlying, including the tendons, bones, they are much infected underside. So we can't ignore each and every classification, whatever the patient's condition, we have to classify any one of these classification, and we can plan according to, and we can even refer to the higher center if needed. Next slide, please. So this is the triangle. We can't, ignore the this triangle that for the Amit Jain's triangle for ulcer classification is the Amit Jain's descriptive classification. Sometimes the ulcer coding also there, and sometimes the ulcer scoring also there. So all in one, this triangle is much more important to treat the diabetic foot ulcer or the neuropathic foot ulcer. Next slide, please. Yeah. This is the best image I could say that to treatment of the diabetic foot ulcer, like first of all, diabetic neuropathic foot neurological evaluation. This whole things is necessary. Whoever treating the diabetic foot, they must undergo and consider this sort of points before doing that. So surgical treatment, biomechanics, neuropathic pain, Charcot foot, clinical practice for any infection or ulceration. These all things, all in one. This image is saying everything. Next slide, please. So I mean to say this. This is the teamwork. No one alone is doing this, and Dr. David Armstrong, this is the best photo he has shared in his website. So teamwork always leads to, decrease the amputation ratio. And Indian Podiatry Association also has the same motto, I prevent amputation. IPA belongs to I prevent amputation. Next slide, please. So I conclude this my presentation with the end of the teamwork, and I really thank Dr. Ariel and the team that given me this opportunity on an international forum, and I will love to work with you on a Indian side, and I'm really happy that I shared my a small knowledge to the diabetic neuropathy and the classification side. Thank you very much.